So those of you who don't know, I'm Oksana, and my sister and I share the same Facebook profile, but I'm an immunology scientist, and today I wanted to talk to you how most of the clinical trial research in the world really is financed by pharmaceutical industry. And I'm going to share with you some really big examples that are super important for people to understand. So you might say that, well, what is wrong with that the clinical trial research is financed by pharmaceutical industry? What is wrong with that? They have drugs that they're developing and they need to test them in order to get them approved by FDA, and they have to do a clinical trial. Well, oftentimes they do it in a trial where people who might benefit from the treatment, providing a sense whether the drug works on us or not. The problem is every step along the way, when pharmaceutical companies are paying for the research, they're expecting results. You see a huge number of problems along the way, including that research that proves that the drug is either harmful or the research gets buried away along the way. And that happens especially with antidepressant drugs. So when the drug proves to be harmful, it's going to be buried. That research is going to be buried and the people are not going to find out about it. So it makes sense. So when they got the control over the research, that's when the pharmaceutical companies get control over the research. They get determined how that research gets used. So now there's scientists in the world right now where they're demanding that drug companies have to register their clinical trials before they do them, and they have to say, this is what the drug company has to say, this is what we are going to study, this is what we are going to look for, and they are the results that will determine the level of success of this drug. If they don't register the trial beforehand, then a lot of major medical journals will not publish the results. And that's a good thing. But it has not always been that way. Because in the past, the trials that proved negative, they buried them. That's what the drug companies did. If the drug showed to have no results at all, they would bury that result. And it has been quite a scandal in the world, has actually become aware of it. And publication biases is really influenced. And we know that because, for example, with antidepressant drugs, drug companies, they bury negative trials to such an extent that it really makes a difference to whether we consider the drug to be effective or not. That's when we add unpublished negative trials to the positive trials of antidepressants, and suddenly the difference between the antidepressant drug and the placebo is minute. So there's no difference between taking the antidepressant drug and taking the placebo, and they would just bury that. And the most famous, let's see if anybody's watching right now. Hi, Renee. Hi, Belami. And so the most famous antidepressant drug that happened that way that they did it before, shows that how pharmaceutical trials do this, is a study called 329, which is a study of paroxetine in children. And it was basically a negative study that showed that there's no difference between paroxetine and placebo, and it has nasty side adverse effects, such as children getting very irritated, and some had horrible suicidal thoughts. And the study was published that it was effective and it was safe, and it was not true. And for legal reasons, the company had to publish all the papers, and it was found that the outcomes that they were initially going to look at were negative. So it had no effect. And then they changed the plan and said, well, this looks positive, and pretend that the data was the actual outcome when it wasn't. And they bury what they said was an outcome in a small print, so that when the main outcome was proposed at the beginning of the trial, it was there in the paper, but you would never know that because it was the main outcome. You would never know it because they would publish it in a tiny line in a small table. That was the actual outcome that showed the drug doesn't work. And then they elevated some tests that showed a small positive effect to the main outcome. So that's how they do it. It clearly shows in the papers. And obviously the study was rejected by some journals that they sent it to, and the journals realized that something fishy was going on and it didn't look right. But they kept trying, even though the study was all wrong, and eventually it got published. And that's the huge problem, that pharmaceutical companies are hiding the actual outcome of the drug, and people never know about it. Another example, when they brought Vioxx into the US, and they already knew that it was a disaster drug because the studies have been done in Europe. This is a Vioxx medication, and they knew it was going to cause X number of heart attacks and X number of strokes, but they set the price so that they could cover the legal expenses. So they knew it was going to kill people. Vioxx is going to kill people. They went ahead and they put the drug out on the market anyway. They just set aside X amount of money, dollars, that they knew what they're gonna profit was gonna take care of any legal expenses. This happens all the time when they bury the data, pharmaceutical companies burying the data, and they ignore the data in the trials and other places. So it's not a healthy system. Makes sense? Hi, Crystal. Hi, Lindsay. Hi, Heather. So let's add another example. Let's take cholesterol. So the major trials have been done by the UK in regards to the cholesterol medications. And over the years, we have discovered that these trials were not being made public. They selectively released information about the trial in a way to make cholesterol-lowering drugs appear to be more effective than they are. So I would argue that cholesterol-lowering statins is the biggest scandal in the pharmaceutical industry over any time, and probably 20 to 30% of you have been either prescribed a cholesterol medication, and when you look at the overall benefits and harms related to these drugs, information that have been either hidden for years or distorted for physicians, you realize that the benefits of cholesterol is very minute of these cholesterol drugs. So for healthy people who haven't otherwise had heart attack or heart disease, the benefits are non-existent of you taking the cholesterol drugs. And people who had heart attack might have 1 to 3% benefit, but still the side effects related to these drugs include muscle weakness and cognitive difficulties. And I'm saying this because people will be going to the doctors and they're saying, I think my cholesterol drug is causing me to have all of these symptoms that you cannot get up, that I cannot get off my chair anymore. And the doctor will dismiss it. And the reason the doctor is going to dismiss your symptoms is because the information of the negative drug effects have been hidden from the doctor for years. And that is the primary, and also this drug, these cholesterol statins, are the primary cause of dementia and Alzheimer's. Every hormone in the body is the basis of cholesterol. And if you don't have enough of cholesterol, your liver will make more because it's primary essential building block of so many things, including brain cells. So the statin scandal might be the greatest scandal of all in the pharmaceutical industry. And that's why I want you to be aware of that your doctor might not even know about the side effects, and a lot of these side effects are hidden by the pharmaceutical company. And they take the drugs and they compare it to the placebo drug, the fake drug, and there's no difference between taking your medicine. And they just want you to sell these medicines. They make it sell for such a huge price that it will cover any legal expenses. So yes, I'm so angry. Anyway, so that is why your doctor will not take care of your side effects that are happening, because they're not aware of it. Everything's being sponsored. All the medications that people take are sponsored by the pharmaceutical industry. And they hide the real study in the paper. They will hide it, what actually happened in the small print, and really make the actual effects like in a huge amount that actually never happened. Anyway, talk to you guys later. If you have any questions, put them in the comments. I just want to share with you these two examples of major drugs that people discovered actually don't have any effect on your body, but they have huge side effects.